Have you ever noticed your heart beating a little faster than usual and wondered, is this normal? Maybe it happened after starting a new medication. Or perhaps you've been taking a pill for years and recently started feeling a strange flutter in your chest. If that sounds familiar, you're certainly not alone. Millions of older adults experience exactly this kind of concern, and today, we're going to talk about something that really matters to your health and your peace of mind. Before we begin, I want to be clear about something important. Everything we discuss today is for educational purposes only. This is not personal medical advice. Every person is different, and your own doctor knows your health history best. Please never make changes to your medications on your own. If you have concerns about anything we talk about today, the right step is always to bring those concerns to your healthcare provider. They are your partner in keeping your heart healthy. Now, let's have an honest and caring conversation about something many people don't realize. Certain commonly prescribed medications can, in some people, have effects on the heart's rhythm or rate. This doesn't mean these medications are dangerous or that you should be afraid of them. Most of the time, they are prescribed because their benefits outweigh any risks. But being an informed patient is one of the most powerful things you can do for your own health. The first type of medication worth knowing about is a class of drugs used to treat conditions like an overactive thyroid. These medications help regulate the body's metabolism, which is important. However, when the dose isn't perfectly balanced, it can sometimes cause the heart to beat faster than it should. Think of your metabolism like the engine of a car. If it's running too fast, every system in the body, including your heart, may feel the effects. If you're on thyroid medication and you've been feeling like your heart is racing, especially after a dose adjustment, that's worth mentioning to your doctor at your next visit. The second group includes certain medications prescribed for respiratory conditions like asthma or chronic obstructive pulmonary disease, what many people know as COPD. These inhalers and pills work by opening up the airways so that breathing becomes easier. But they can also stimulate the heart in a way that may cause palpitations or a faster heart rate in some individuals. If you or someone you love relies on these medications to breathe comfortably, please don't stop using them. The ability to breathe well is critical. But if you're noticing heart-related symptoms, let your doctor know. There may be alternative formulations or doses that work just as well for your lungs, with fewer effects on your heart. The third type involves some common decongestants. Many of us reach for these over-the-counter products when we have a stuffy nose, especially during cold and flu season. What a lot of people don't realize is that the same ingredient that shrinks swollen nasal passages can also cause blood vessels throughout the body to narrow. When that happens, the heart sometimes has to work harder. And in some older adults, this may contribute to an elevated heart rate or a rise in blood pressure. For people who already have heart concerns, even something as simple as a cold remedy purchased at the pharmacy deserves a second look. It's always worth asking your pharmacist, is this safe for someone with my heart history? The fourth category includes a type of medication often used to treat psychiatric conditions, such as anxiety or depression. These are incredibly valuable medications for many people, and they can genuinely improve quality of life. However, some of them are known to have effects on the electrical system of the heart. This doesn't mean they're harmful for everyone. Far from it. But your doctor may want to monitor your heart more closely while you're on these medications, especially when you first start taking them or when the dose changes. An annual or periodic heart check, such as an electrocardiogram, may be recommended simply as a precaution. That's good medicine, not something to worry about. The fifth type is perhaps the most surprising: certain antibiotics. We tend to think of antibiotics as straightforward medicines that fight infections, and they are. But some specific types, used for certain kinds of infections, have been associated in studies with effects on heart rhythm in a small number of people. This is particularly worth knowing if you already have underlying heart conditions. Again, the key word here is some. Not all antibiotics carry this concern, and when one does, your doctor will weigh that risk carefully against the need to treat your infection. If you're ever prescribed a course of antibiotics, it's perfectly fine to ask, are there any heart-related side effects I should watch for with this one? Now, here is the most important thing I want you to take away from everything we've talked about today. Never, under any circumstances, stop taking a prescribed medication without first speaking with your doctor. Even if you suspect a medication may be affecting your heart, stopping suddenly can sometimes cause more harm than the medication itself. Your doctor can help you find a safer path, whether that means adjusting your dose, switching to a different medication, or simply monitoring you more closely. What you can do, starting today, is become a more informed and engaged patient. Keep a simple journal of how you feel each day. Note whether you experience any changes in your heartbeat, including if it feels unusually fast, slow, or irregular. Write down the time, what you were doing, and whether it passed quickly. When you bring this kind of information to your doctor, it helps them make much better decisions about your care. You're not just a passive recipient of prescriptions. You are an active part of your own healthcare team. There are also some general lifestyle habits that researchers believe may support heart health over time. Staying gently active, even a short walk each day, is associated with better cardiovascular health. Eating a diet rich in vegetables, whole grains, and healthy fats, while reducing heavily processed foods, may help support normal heart function. Getting good sleep, managing stress through activities like gentle breathing exercises or time spent in nature, and staying well hydrated are all simple habits that can contribute to a healthier heart over the long term. None of these replace your medications or your doctor's guidance, but they work beautifully alongside them. It also helps to review your complete medication list with your doctor or pharmacist at least once a year, or whenever a new medication is added. This is sometimes called a medication review, and it's one of the most underused tools in older adult healthcare. When different medications interact with each other, the combined effect can sometimes be more pronounced than either medication alone. Your pharmacist, in particular, is a wonderful resource for this kind of review and is often easier to reach than a specialist. If you ever experience a sudden and dramatic change in your heartbeat, one that is accompanied by chest pain, dizziness, fainting, or shortness of breath, please don't wait. That kind of symptom deserves immediate medical attention. Call emergency services or have someone take you to the nearest emergency room. It's always better to be checked and reassured than to wait and wonder. The goal of today's conversation was not to frighten you. It was to empower you. Understanding that certain medications can affect the heart helps you ask better questions, notice important symptoms sooner, and work more effectively with the healthcare team that cares for you. Knowledge is one of the best tools we have for a long and healthy life. You are not alone in navigating these questions. Millions of people your age are managing medications, watching their heart health, and learning something new every day. And that's exactly why Prime Daily Health is here, to give you clear, trustworthy information in a way that respects your intelligence and your time. If this video was helpful to you, please give it a like and share it with a family member or friend who might benefit from hearing this. We'd love to know your thoughts in the comments below. Have you ever noticed changes in how you feel after starting a new medication? How did you handle it? Your experience might be exactly what someone else needs to hear. And if you haven't already, please subscribe to Prime Daily Health. We're here every week with helpful, honest health information made especially for you. Because staying informed is one of the kindest things you can do for yourself and the people who love you. Take good care of your heart, It's been working hard for you every single day.